liquid and tablets. Even some meds can be compounded into chews. So there are pretty much the same kind of medications that you can give to a dog or a human. We're going to have similar for cats, but they're actually made for cats because the cat's bodies process things completely differently than dogs and humans. So although we might have certain same classes of drugs like anti-nausea, so like Zofran for humans, we have Serenia for cats.
Do you have any tips on how to give my cat their medicine?
So this is a really good one. So cats don't follow the textbook, and cats are really not fun to give medication. I don't care who you talk to or how long they've been in the field. Generally, cats are going to be one of the most challenging to give medications. Some owners feel that liquid medication is easier. I personally think that tablets or capsules are easier because we can pill a cat and then be one and done versus liquids. Generally, cats have a very sensitive sense of taste, and if they don't like something, they're going to drool or foam, and that can actually be quite scary to an owner if you've never seen it before. It can look like they're having an allergic reaction, and really they just don't think something tastes good. So as far as medicating cats, it's going to be owner preference and cat preference. Every cat is different. You're going to have to gauge what's going to work best for your cat, and if the first thing doesn't work, don't be afraid to call and ask and say, hey, this liquid's really difficult to try. I'd like to try a tablet, and then we can teach you how to actually pill your cat at home.
Why is it important to avoid self-diagnosing my cat's need for pain medication?
So cats are very good at hiding their illnesses, and I would probably say we don't often see a ton of owners doing this because cats are so well versed at hiding their pain. They're generally going to sleep, hide, be less likely to jump on things. Sometimes it is overt, like if you see your cat limping, then clearly we know something hurts, because if we're limping, it's because it hurts. We want to avoid, though, starting medications without the guidance of a veterinarian, because if you do use something over the counter, cats, there are actually quite a lot of drugs that are toxic to cats, like aspirin and Tylenol, Advil. They are deadly to cats, so we need to make sure that we're using things that are specifically labeled for the feline patient.
Why is early detection so crucial in getting a good result from cat medications?
So with cats, this kind of goes back to that cats hide their illnesses. They are masters at hiding how they feel. We always say that cats don't follow the textbooks because they don't. They take the textbooks and they throw it out the window. That's what cats do. So we have to make sure that at the first sign of illness, meaning if we're not eating, maybe we're drinking more than normal, or if your cat used to sleep with you all of the time and all of a sudden your cat isn't sleeping with you, subtle symptoms. Early detection is always going to be better, because the earlier you know something's going on, the easier the fix is going to be, versus if you let something continue to get worse and get worse and get worse, then not only are you going to be dealing with the original problem, but then you're probably going to be dealing with dehydration and other things, and it can just turn into a snowball effect. It's much cheaper and more effective to diagnose earlier rather than later.
Why should I purchase cat medications from my veterinarian instead of through an online pharmacy?
So this is a really good question. In the veterinary community, we battle this on a daily basis. There are big pharma like 1-800-PET-MEDS, Chewy.com, the list just goes on. There's like hundreds of them. A lot of times with those online pharmacies, we can't guarantee, number one, that they're storing their products appropriately. A lot of these products have temperature needs that aren't always met, or they have to be, maybe they're light sensitive, and we can't guarantee that these large warehouses that these medications are treated as appropriately. Also, most manufacturers will not back up that product that's coming from an online pharmacy because it's not controlled, because the environment isn't controlled. When you purchase either from your veterinarian's online store or directly from your veterinarian, you know that the product has been treated the way it's supposed to, and we're following the recommended instructions. For instance, as a vaccine sits out for more than 10 minutes, like at Tractor Supply, the vaccine starts to degrade, and so a client can go and buy a vaccine and think that they're giving their puppy a parvo vaccine and think that they're all good, and then 3 weeks later the puppy has parvo, and the client comes in saying, well, I got my vaccines, I don't understand. And then I get stuck with having the really fun conversation of saying, hey, while you thought you were doing the best for your dog, we can't guarantee that the product was treated appropriately when it was at this place that you got it from. So all things to be considered when we're talking about online prescriptions.